Good evening, students, and welcome to your second semester. This lecture will be on conceptualizing disease and is meant to help you develop a foundation for approaching disease processes as we move forward in this semester as well as coming semesters. There is no reading assignment for this topic, so just listen and enjoy. We will begin, as all things do, on the cellular level. For the purpose of this content, imagine the cell as a factory. Consider what a factory does and how it works. Inside the factory are assembly lines, just as there are organelles inside the cell. Reactants come in, for example, oxygen, nutrients, molecules, etc. They are processed by machinery and workers. Products come out, such as hormones, proteins, etc., and waste products are produced and excreted. The goal of the assembly line is the survival of the cell. The products are dependent on the reactants, and the reactants are a reflection of what the organism as a whole needs. Adaptation and accommodation of the assembly line, the cell, and ultimately the organism must occur within its environment in order to maintain a dynamic equilibrium, or homeostasis. Components that determine homeostasis can be broken down into four categories: foundation, integrity, permeability, and response. Let's take a closer look at these and apply them to our factory. A good architect knows that a structure must be built on a good foundation. Think of this referring to the design and implementation of a blueprint. The integrity is determined by the strength of the structure, as well as the ability of the structure to withstand forces. Without being a whole and united structure, the structure would fall. All biological systems are open systems, meaning they can interact with the environment. Things can enter the system and things can leave the system. Permeability refers to the allowance of passage of objects into and out of the system. Response refers to the alterations and actions the structure performs in the face of a stimulus, such as a change in the environment or demand. When this is applied to the cell, you can imagine how various subcomponents fit within these four components of homeostasis. We will elaborate on each of these in future slides. Let's now discuss how disease occurs. The process begins with the application of an injurious agent. The organism will then attempt to adapt to this change. If the organism is successful, homeostasis will be restored. If the organism fails to adapt, cellular injury occurs. Once cellular injury occurs, accumulation of waste products results. Once waste products accumulate, death of the cell ensues. It's important to note here, as you likely already know, that changes in tissues, organs, organ systems, and ultimately the organism are a reflection of what occurs on the molecular and cellular level. When you're approaching a disease, for example liver disease, think of the cellular functions. We know that the liver has a lot to do with removal of toxins, so you can assume that hepatocytes have a large volume of smooth endoplasmic reticula, which function to remove toxins, among other things. So then, in liver disease, you could anticipate as the disease worsens, the body will build up certain toxins, producing the symptoms of liver disease, such as hepatic encephalopathy, which is the result of accumulation of ammonia. Here are the stages of disease progression listed out for you. In essence, disease boils down to malfunction of the machinery inside the organism, which is ultimately a malfunction of biochemical processes. Now let's take a look at each of these stages in more detail, beginning with application of injurious agents. Think back to the components that determine homeostasis. These become four key areas for the cause of disease. As we discuss each of these key areas, I will provide some examples of disease processes that characterize the components and subcomponents. So we'll begin with foundation. This refers mainly to genetics. So a change in the blueprint will set the organism up for a change in structure and function, either by acting as the disease itself or by making the organism susceptible to disease. There are many genetic or congenital diseases that exemplify this. Examples of mechanical forces include blunt trauma, penetrating trauma, and mechanical stress. And I provided some examples under each of these topics. Heat results in coagulation of protein. To exemplify this, think of what happens to an egg when it boils. The stiffening of the egg is a result of coagulation of proteins. Cold results in the formation of micro ice crystals, which expand and then contract, resulting in shearing forces against the cellular structural components. The cells most susceptible to changes in temperature are neurons. So you might anticipate that altered mental status may be a key finding in a patient who is exposed to temperature extremes, both from internal and external sources. An increase in altitude results in a decrease in oxygen because of the pressure difference in the atmosphere. A sudden decrease in pressure results in bubble formation from gases. These gases are under pressure and are like small lead balls. In a mild situation, these bubbles can form capillary blockage. In a more moderate situation, they can result in expansion of the tissue, like foam. And in a severe situation, such as an explosion, tearing of the alveoli can occur. This is because you can't compress hollow organs, such as the lungs. With radiation, gamma waves hit reactive molecules that react with DNA. This reaction results in improper reading of DNA as well as inappropriate binding of nucleotides. Free radical formation also occurs. This becomes problematic when it affects DNA controlling rapid cell division, resulting in neoplasms. Hypoxia is a lack of sufficient oxygen due to the following factors: ischemia, which is the most common, which is a lack of blood flow, decreased oxygen in the air, reduced hemoglobin, respiratory or cardiac diseases, and poisons or toxins. This results in decreased oxidative phosphorylation, which results in decreased ATP, which leads to anaerobic metabolism and decreased sodium pump activity, which ultimately leads to cellular swelling. There are a variety of chemicals that produce disease. I've listed some examples for you here. Lead halts DNA synthesis. Carbon monoxide has a 200 times affinity for hemoglobin and effectively takes the place of oxygen when binding to hemoglobin. There are several street and social drugs with varying effects. Arsenic inhibits oxidative phosphorylation. Infection is relatively straightforward. A pathogen enters through a portal of entry and either directly or indirectly causes damage. The disease-producing potential of a pathogen depends on its ability to invade and destroy cells, produce toxins, or produce damaging hypersensitivity reactions. Examples of nutritional imbalances include the following: hypolipidemia, which results in the formation of ketone bodies, which function as acids in the system, and mobilization of adipocytes. Hyperlipidemia, which leads to lipid deposition in the vasculature. This is often associated with strokes and heart attacks. And hyper and hypoglycemia. Refer back to the nutrition chapter for more examples. The last component is response. There are two general responses that occur: immune and adaptation. The root of the inflammatory cascade is the mast cell. Mast cells contain chemical mediators within granules that modulate the response. Anytime you think of inflammation, think of mast cell degranulation. Additionally, anytime you think of inflammation, think scar tissue formation. Traditionally, inflammation includes the manifestations of erythema, heat, pain, and edema. A fifth component of inflammation is loss of function. Scar tissue does not function like normal cells. There is essentially a loss of cellular machinery and membrane function. A good example of this is with action potentials. Action potentials cannot propagate through scar tissue. So if there were a large amount of scar tissue on the heart, certain portions of the heart will no longer be able to contract. When inflammation is excessive, the condition is referred to as an autoimmune disease. The cell adapts to changes in the environment. There are 5 forms of adaptation: atrophy, hypertrophy, hyperplasia, dysplasia, and metaplasia. Before we move on, know that we've just covered all of the fundamental causes of disease. Although there are many disease names and variations, their fundamental causes remain the same. Try to think of these when you are studying individual disease processes, and it'll help you conceptualize them. Now we will take a closer look at adaptation. You will see these terms when reading about different disease processes. Atrophy is a reduction in the functional components of the cell. For example, the cell will contain less endoplasmic reticula, mitochondria, and myofilaments. There will be an increase in hydrolytic enzymes that cluster in what's referred to as autophagic vacuoles. This functions like a trash can in the cell. The result of this is the byproduct of residual bodies, basically leftover trash. Atrophy occurs due to decreased use, workload, pressure, blood supply, nutrition, and neurohormonal stimulation. A normal example of this is thymus gland atrophy in early development. A pathophysiological example of this is casting. After taking off a cast, you will notice that the limb appears to have shrunken. Basically, if you don't use it, you lose it. Hypertrophy is an increase in protein accumulation in components of the cell. This can occur in the membrane, the ER, myofilaments, mitochondria, and the nucleus. Hypertrophy is due to stretch as well as trophic signals such as growth factors. The result is an increase in cell size. Hyperplasia is an increase in the number of cells due to increased division. Examples of this include compensatory hyperplasia, which occurs in regeneration such as with the liver, epidermis, intestines, and bone. Hormonal hyperplasia, which can occur in estrogen-dependent uterus and breast development. And pathologic hyperplasia, which can occur with excessive hormonal stimulation, such as with growth factors on target cells. Dysplasia is a change in the size, shape, and organization of mature cells. Examples of this include the epithelial tissue of the cervix or respiratory tract. Dysplasia is not neoplastic, but is often found adjacent to neoplastic growths. Metaplasia is the reversible replacement of one mature cell by another, sometimes less differentiated type of cell. The best example of this is the smoker's airway, where ciliated pseudostratified columnar epithelium is exchanged for stratified squamous epithelium. Stratified squamous epithelium is more resilient to the irritation induced by smoke. When adaptation fails, cellular injury occurs. There are common themes that you can see on a cellular level when adaptation fails, regardless of the injurious agent. These include ATP depletion, free radicals or reactive oxygen species, loss of calcium steady state, and defects in the membrane permeability. With ATP depletion, there's a loss of mitochondrial ATP, as well as decreased ATP synthesis. This results in cellular swelling because of the lack of ATP available to maintain the sodium-potassium pumps, decreased protein synthesis due to the lack of ATP to drive the process, decreased membrane transport due to the lack of ATP available for active transport, and lipogenesis, or the generation of lipids, due to the need for some form of energy storage. All of these changes contribute to a loss of the integrity of the plasma membrane. Oxidative stress is basically an imbalance of oxidants and antioxidants, which produces a cascade that overwhelms the cellular machine. Examples of this include inflammation, acetaminophen toxicity, iron poisoning, and carbon tetrachloride. Essentially, as you add electrons to oxygen, free radicals form. The first is superoxide, or O2-. The second is hydrogen peroxide, and the third is hydroxyl. In the end, additional electrons will result in the formation of water, but at this point there will be a high concentration of hydroxyl free radicals in the system. The cellular effects of oxidative stress include the following: peroxidation of lipids, which results in vasoconstriction, inflammation, and the development of a prothrombotic environment, where the individual is at increased risk for clot development. Protein changes and fragmentation of the polypeptide chain, and DNA breakdown or oxidation into single strands. Elimination of oxidants or free radicals can occur through antioxidants such as vitamin A, C, and E, metal carrier proteins such as transferrin and ferritin, and enzyme systems. Oxidative stress can ultimately lead to the destruction of cell membranes and cell structure, resulting in a loss of selective permeability. It also has specific effects on the mitochondrion. Mitochondria lack enzyme systems to remove oxidants, therefore they're more susceptible to oxidative stress. In addition, destruction of the mitochondrial membrane occurs, resulting in a loss of oxidative phosphorylation. Another common theme of cellular injury is the loss of calcium steady state. Normally, calcium in the cytosol is low. Ischemia and some chemicals cause an increase in calcium in the cytosol. Sustained increases in calcium continue to increase with damage to the plasma membrane. Calcium causes intracellular damage by activating a number of enzymes. Finally, an early loss of selective membrane permeability is found in all forms of cellular injury. This results in the increased ability of molecules to enter and exit the cell freely, producing a loss of homeostasis. On a cellular level, disease manifests as accumulations. Essentially, the assembly line can't go on because of excess substrate production, accumulation of abnormal substances, failure of effective catabolism, or excessive exposure. Examples of accumulations include water, lipids, carbohydrates, glycogen, proteins, pigments, calcium, and urate, or uric acid. On a systemic level, once accumulations alter the environment, systemic symptoms are experienced, such as fever, tachycardia, leukocytosis, pain, and the presence of extracellular fluid enzymes. The final stage of disease progression is cellular death. There are three distinct forms of cellular death: necrosis, apoptosis, and autophagy. Necrosis is cellular dissolution due to a loss of membrane integrity, organelle swelling, and mitochondrial dysfunction. This is a process of cellular self-digestion or autolysis that lacks the features of apoptosis. Apoptosis is programmed cell death, which may be normal or pathological. This is due to severe cellular injury, accumulation of misfolded proteins, infections, or obstruction of tissue ducts. Autophagy is cellular recycling by self-eating. When cells are starved or nutritionally deprived, cannibalization and recycling occurs. This improves the survival of other surrounding cells. To recap, disease progresses through specific stages. The first step is exposure or application of the injurious agent. The second step is adaptation, where the cell attempts to compensate by adapting to the change or recruiting help. The third step is cellular injury, where adaptation fails and homeostasis or dynamic equilibrium cannot be maintained. The fourth step is accumulation, where the cell begins to accumulate substances. And the fifth stage is cellular death, where the cell succumbs to injurious changes. So how do we apply this? When you're reading about disease processes, you will likely see a pattern of these processes among diseases. Let's take another look at the factory. What we really want to understand is what's going on inside the factory. One of my favorite nursing quotes is, "The nurse becomes a master of the human response to illness." The response includes all of the human dimensions, not just the physical dimension. However, in order to understand the response, we need to have an idea of what's going on inside acting as the stimulus. This ability falls back on our ability to perceive. To exemplify this, how would you perceive a factory? Your ideas for how you would perceive a factory may have fallen into one of these categories: how it appears visually, how it smells, the sounds it makes, and the feel of the factory, meaning the gut feeling that you have about the factory. These are all good methods for perceiving an object and may be similar to how you approach a patient that you're caring for. On the other hand, some perceptions can be closely associated with judgment, bias, assumptions, and generalizations. The key idea here is that perception drives conceptualization. Our senses perceive an object or organism. That information is then integrated where proposition meets concept, or in other words, where glue attaches components that make up an organism or object, and we arrive at a conceptual product. This conceptual product drives how we think and feel about our patients. And this has everything to do with how we approach and care for our patients. So be aware of how you think about your patients and be open to alternative types of glue. Let's zoom in and take a closer look at the wall of the factory. The wall provides a good visual for how concepts can be related to each other. These are all methods that aid in our perception of what's going on inside the individual. Once these concepts are connected, a big picture and an understanding in the human response develops. Drawing connections between these concepts to see the big picture aids in our understanding of the problem and what to do about it. Studying disease concepts builds our perception of the individual and their condition. I'll leave you with a quote: "Experience without theory is blind, but theory without experience is mere intellectual play." In order to fully conceptualize disease, aim towards the merging of theory and practice. The patient will not always fit perfectly into a theoretical framework because we are all unique. Try to fit the theory to the patient and not the patient to the theory.